So, why is the cost of private healthcare so high in South Africa? Well, government is trying to get answers to that question. Economic Development Minister Ibrahim Patel says the Competition Commission will investigate the private healthcare sector. The commission will have the power to summon people to testify or provide documents. Patel's office says the inquiry will also be able to ask for any necessary information at once. The inquiry is expected to start in September and could take up to 2 years to finalize. For more on this story, we're joined in studio by South African Private Practitioners Forum CEO, Dr. Chris Archer. Thanks so much for your time. Just tell us, what do you feel about this investigation to happen this year?
Well, we welcome it. I think there's a lot of misunderstandings about the cost of private healthcare. You mentioned that private healthcare in South Africa is particularly high. In fact, the evidence is of quite the opposite. If you look on a price parity basis and you compare South African private healthcare with the cost of healthcare per person in the UK or New Zealand or Australia, you'll see that the South African private sector compares extremely favorably. But if you look at it compared to the amount of money spent by the South African state on the public sector, then yes, it does look expensive. But you must remember that the money that is spent in the private sector in South Africa is private individuals' money. It's not tax money. And what people choose to spend on their own health care is surely their own decision. I mean, it's a bit like what you choose to spend when you buy a house or a motor car or whatever. If you've got the disposable income, and that's what happens. People who can afford the luxuries of life will spend more. And that's not to say that private healthcare is a luxury in South African terms. It might appear to be so, but in fact, as I've tried to explain to you, in world terms, we compare extremely favorably.
So how are prices governed? Is there a standard price? Is there a guideline? Who decides this?
Well, up until 2003, there was a process. The Medical Association and the Board of Healthcare Funders, and prior to that, the Representative Association of Medical Schemes, would meet once a year and try and agree on a price. Now, if you look at historically what's happened over the last 40-odd years, the private sector price, the Medical Association price, that was reflected in the Medical Association's guide to billing, has always tracked the inflation rate very, very closely, whereas the medical aid rate has always been set at about a 2 to 3% disadvantage to the CPI. So over the years, what has happened is that there has been a widening gap between what was charged in the private sector in the old days and what the medical schemes are prepared to pay. Now, in 2003, what happened is the Competitions Commission was asked to intervene, and since that time, there has been no negotiation because all the parties were deemed to have been colluding on setting prices, and since that time, that hasn't happened. Following that, what happened was that the government introduced firstly the Council for Medical Schemes, and then it took it over itself, the reference price list process, where they attempted to determine a fair price for medical services. Now, that never actually took, it never came about, because eventually, when it became apparent what the real costs of healthcare actually were, the government wasn't prepared to implement.
Now, you say you welcome this investigation.
Absolutely.
Are you absolutely sure that there's nothing unfair happening in terms of competition and collusion in this industry?
As far as I'm aware, there is. I can't talk for the hospital industry or any other industry or other allied services, but to my knowledge, there have been very few examples where one could say there has been collusion. And the collusion, the one example that I can recall concerned collusion between some radiologists and neurosurgeons that made the front pages of the news. But apart from that, I'm very confident that this inquiry will show that in the private sector at large, there's very little wrong with the way medicine is practiced.
Okay, thanks very much for your time and joining us in our studios. That was the CEO of the South African Private Practitioners Forum, Dr. Chris Archer.
News that moves. eNCA.com.